So, speaking about pathology, one of the major mechanisms of pathological process is the process of cellular death, and we deal with this on a daily basis. So, the physiologic cellular death as a result of a normal cellular senescence is called apoptosis. However, in many cases, the death of the large number of cells is what we call necrosis. Based on that, necrosis can be split in a couple of different types. The most common type, this is the coagulative necrosis, in which in general the organ architecture remains preserved. It's preserved because the intracellular proteins coagulate, but the nucleus will be missing when we examine these organs. The next most common type of necrosis, this is a liquefactive necrosis, and it's a type of necrosis that we often observe in the brain. And it's a result of release of proteolytic enzymes which simply digest the tissue completely. Okay, so gangrenous necrosis is a subtype of coagulative necrosis in which the result of a tissue infarction and coagulation of the proteins will lead to actual mummification of the tissue. We commonly observe this in the lower legs, particularly in the toes, as a result of a very advanced microvascular damage due to the diabetes. So caseous necrosis is a type of necrosis which we see usually in the context of bacterial infections. So it's a combination of coagulative and liquefactive necrosis. So in the center of the caseous necrosis, this cheese-like material, it's actually liquefactive necrosis, and it's usually organized by granulomatous reaction around it, which is usually palisading histiocytes and multinucleated giant cells, and that is the coagulative component of it. One very common type of necrosis that we deal almost on a daily basis is a fat necrosis, and vast majority of the time this is a damage to the adipose tissue, which is the subcutaneous tissues basically, due to a garden variety of traumas. However, fat necrosis is commonly observed in processes, for example, like acute pancreatitis, in which sometimes the proteolytic enzymes can actually leak outside of the pancreas, and it will result in a digestion and calcification of the adipose tissue, a process which we call saponification also. Fibrinoid necrosis is necrosis that results due to a damage to the vessels. We talk about polyangiitis, polyarteritis nodosa, rheumatoid arthritis, things like that. And I'm going to add one last type of necrosis which we often observe, and this is a tumoral necrosis, which is usually seen in a small cell carcinoma